So to understand how COPD works, you have to understand how air flows into the lungs. So first, you inhale air through your nose, obviously, and then it'll go through your pharynx, your larynx, your trachea, your primary bronchi, secondary bronchi, tertiary bronchi, terminal bronchioles, respiratory bronchioles, and then it'll arrive at the alveoli, which is where gas exchange happens. And so there's capillaries running over your alveoli, and oxygen will move from the alveoli into the blood, so that the blood can deliver oxygen to the muscles and tissues, and then CO2 from the tissue, the muscles, will be transferred into the alveoli to be exhaled. So your airways and your alveoli are elastic so that they can expand and deflate when air comes in and out of your lungs. And with COPD, one of or all of four things will happen. So your airways and air sacs lose elasticity. Your walls between the alveoli are destroyed. The walls of the airways become thick and inflamed, making it harder to breathe. And your airways will produce more mucus than usual, which will clog the airways and, again, make it harder to breathe. So within the big umbrella of COPD, there's two main conditions. The first one is emphysema, which is a damage of the walls between air sacs. And the air sacs will actually lose their shape and become floppy, which leads to the destruction of the walls of the air sacs. And this leads to a small amount of large alveoli instead of many small alveoli, which is what we want. And then this will cause a reduction in gas exchange. The second one is chronic bronchitis, and this is when the lining of the airway is constantly inflamed and irritated. And this leads to a thickening of the lining due to excessive mucus production, and this will make it harder for the patient to breathe.
Alright, so some signs and symptoms for COPD can be mild to severe depending on the severity of the disease. For the mild symptoms, it can be ongoing cough or one that produces mucus, shortness of breath with activities like working out, wheezing, or tightness in the chest. Some severe symptoms of COPD include having a hard time catching your breath with simple things such as talking, your lips or fingernails turning blue or gray due to a lack of oxygen in the blood, you're not as mentally alert, and you can have a faster heartbeat.
Hello, Sarah. We're going to have to go through some tests today to be able to diagnose your chronic conditions. So we have 3 different types of tests, but we're going to want to choose one depending on her pain tolerance and her budget. So the first test we have is the spirometer test, and that'll be a simple, effective, painless test where it just measures her volume of her lungs and the strength of her lungs. And then we can also take your blood and measure the oxygen, and we can compare that with our other data that we have, some controls, and we'll get a good estimate of your ventilation to perfusion ratio. And if so, it will have a low oxygen count. Or if you really want to go there, we can take some chest X-ray scans and get a good picture of what your lungs are looking like. So what's it going to be?
I don't know. I think I'll go with X-ray.
There it is.
There. Unfortunately, there is no cure yet. However, lifestyle changes and treatments can help you feel better and slow the process. The most common treatments can include not smoking, if you do, avoid any secondhand smoke or irritants. You may have trouble eating, so I would suggest a dietary plan for you. Medicines include various bronchodilators, which you can take through an inhaler, which is very common. And if it's too severe, you might look into surgery or lung transplants. So, depending on how you feel.
I'm Sarah, and I have COPD.
The most expensive and most painful one is the spirometer. Oh wait, that's completely wrong. It appears that you do have COPD.
Try to
Sorry.
I'm Sarah, and I have COPD. I'm Sarah, and I have COPD.